thank you, and thank you for this invitation. So I want to talk a bit about children, poverty, its effects on their development, and then potentially what we can do about that. And so I'd like to ask the group as a start to keep a few facts in mind as we talk about college and career readiness, which obviously is the focus of this. And the first is that in 2013, 15% of the U.S. population, now that's 47 million people, 47 million people were living in or below the poverty line. That's one that you should keep in mind. And the other is that there are 74 million children in America, and 22% of them live in poverty. So that makes them the poorest residents of our nation. So think about that for a minute. The youngest, the most vulnerable to risk to their health and development, and the poorest. And so, unfortunately, this is very difficult. I can barely see it, and I'm standing on top of it. But, you know, as Americans, we consider our country to be the greatest, if not one of the greatest, in the world. But I'd like to draw your attention to this information about relative child poverty in 35 economically advanced countries. So we're starting at the top, and at the top we have Iceland, and this is the U.S. It's second from the bottom. What does that say about the U.S. when U.S. ranked 34th out of 35 countries, above only Romania, and below virtually all of Europe, plus Canada and Japan and New Zealand? And this poor showing for the U.S., I think, is a clear reflection of our country's growing income inequality, because that would explain why, at least on child poverty, that we're ranked between Bulgaria and Romania, even though Americans are 6 times richer than the residents of either of those countries. And if we talk about children, and I want to focus for the most part on younger children, children under 16 years old. If we look at poor families, low income and poor families, for a span of 2006 through 2012, we see that there hasn't been a great deal of change in where poor children stand. And if we were to look at, and this is all children under 18, if we look at the distribution of poverty across the U.S., again, it may be difficult to see, but the yellow is lowest percentage, then brown, blue, and purple at the top. And again, we see where the poverty tends to be aggregated. And this looks at child poverty and by state, but unfortunately, 96 of the largest metropolitan areas continue to have poverty rates that are as high as they were prior to the recession. And then the last thing I want to do is sort of pit poor children against seniors or others. But if you look at, and actually there's a pointer, so if you look at poverty rates here, so for those under 18, this is their rate of poverty. If you look at 18 to 64-year-olds, this is theirs. And then if you look at those 65 and older, this is the rate. So again, it's not so much pitting children against other age groups, but it's about thinking about what kinds of policies and programs are in place that make a difference for seniors, but perhaps are not in place for children living in poverty. And then among children under 6, 48%, and that's 11.4 million, live in low-income families. Then there's 25% in poor families, and then 12% in extreme poverty. And when we talk about the effects of poverty on children, it's very important for us to think about extreme poverty, to think about poverty's persistence over time, because 10% of our nation's children are persistently poor. That means they spend at least half of their childhoods living in poverty. And children who are born into poverty and spend multiple years living in poor families have worse adult outcomes. And I don't think that's surprising, but the data bear it out. Intuitively, we know it, but the data certainly shows that to us. And this will be very, very difficult for people to see, so I'm just going to summarize it quickly. So in talking about poverty and what it means for children's development, and in turn their college and career readiness, we need to look at what the data can tell us. And these data are from which was at the time a groundbreaking meta-analysis. So taking a range of research over time, looking at poverty and its effects on cognitive development, on physical health, et cetera, we found that there is a clear relationship between poverty and children's health, achievement, and behavior. And so children who live in extreme poverty or live below the poverty line for multiple years suffer the worst consequences, and these data bear that out. And children who experience poverty during their preschool and early childhood years have lower rates of school completion than children and adolescents who experience poverty in later years. And so on a range of indicators, whether it's health or it's number of years of short stay hospital episodes, or the stunting or developmental delays, there are data that show the association in significant ways. And then this is from a recent report around boosting family income to promote child development. And you can see, again, it's looking at recognizing numbers and the percentage of kindergartners who can do that with middle income is the top, near poor, below it, and poor. And the next one is beginning word sound. Again, you see the differences. The next is counting and base and shape. Again, relating to Laura's mention of both reading as well as math. And then on the bottom is ordinality sequence. So in all cases, we can see a difference, and a statistically significant difference by income. And so this is why the National Center for Children in Poverty is focused very clearly on both children and their families. And we're a nonpartisan public policy research center that really focuses on promoting the economic security, the health and well-being of poor children and families in America. And we help policymakers understand what kinds of policies should be in place, are in place, that are working. We help service providers understand the kinds of programs and policies that research has shown have been effective. We help advocates really advocate for, again, policies and programs and resource allocations, because advocating for the policies and programs without the resource allocations to implement them won't take us far. We work with other researchers, sort of filling in the gaps about what we don't know and what we need to know, and also the media, sort of helping them tell the stories of poor children and families in America, and shining a spotlight on the power of prevention. And most people know us through our website, nccp.org, where we take the census data every year and provide basic facts about children in age ranges. We have a range of interactive tools so that you can actually choose your state and then find out how many children are in poverty, by what age ranges, what kinds of policies are in place in each state. And we also operate the Child Care and Early Education Research Connections. We're in our 11th year of funding through HHS, the Office of Planning, Research, and Evaluation, to really focus on the kinds of high-quality research on child care and early education that exists. to help policymakers and other researchers to identify the latest research, and also if researchers are interested in accessing databases so that they can do their own secondary data analysis, or to develop a bibliographies based on the database of research articles that we have, to create bibliographies on specific topics that may be of interest to researchers or policymakers. And most recently, a lot of the requests have been about immigrant families, second language learners, what we can, where those families stand and what we can do about it. And through all of this, what we know is children do better when families do better. And we know that the kinds of associations between low income of families and the achievement of children is very much linked, because we know that poverty has an effect on children's cognitive development and their ability to learn. It contributes to behavioral, social, and emotional problems. It can cause or exacerbate poor child health. And again, children at greatest risk are those who experience that kind of economic hardship when they're young and experience it over time. And one of the things that we know is extremely important when we talk about child development is social emotional competence. And about 9 to 14% of all young children have some kind of social emotional difficulties, but unfortunately upwards of 30% of young children living in poverty have those kinds of problems. And so for us, as a center, a nonpartisan center that really is focused on trying to help those who are real stakeholders, and truly all of us are, but stakeholders who really are in a position to make change, that we really believe that state policy choices matter. We're a national center, but our focus is not on federal policy as much as on state policy, because how a state chooses to allocate federal and state funds, promote quality in services, and establish eligibility criteria influence who has access to needed services and who doesn't. I mean, you all know that. That's very simple. And that we also believe that research should inform state policy. The research on the effects of poverty, the biology of the developing brain, the cumulative effects of risk, the effectiveness of evidence-based interventions are essential to inform policy issues. And often the center will get calls from policymakers, advocates, et cetera, who have an idea about something, and often they think it's a new idea, and it's a great idea. But unfortunately, or fortunately, because at least we can say, well, you know, we can name the state that has tried this and it didn't quite work out, or connect a policymaker with another policymaker in a state, or advocates in a state, to talk about what they've learned from what they've done and what they'd suggest not trying again. And then balance is required, because strong policies in one area can be undermined by weak policies in another area. So in terms of the balance of policies and programs across health, early care and education, and family support are important. And again, a focus on vulnerable families really has to be a priority. And these are the things that we believe, but based on what we know about the effects of extreme poverty and long-term poverty on children's health and development, and a family's economic success or not, make it essential that the most vulnerable families have priority. And so I mentioned our website and the kinds of data and tools that exist, but a couple that I'd recommend to people are our young child risk calculator. So by going into our website, choosing your state, you can see how many young people are experiencing individual or multiple risks that affect their development and school readiness. So you can choose the age range. So you might want to do under 3. How many children under 3 live in extreme poverty? And then how many children under 3 are in households without an English speaker, a large family, low parental income, et cetera, to be able to get a profile in your state of what children in poverty and at what level of poverty, what that looks like. And another is the early childhood state policy profiles, and those are available in categories of early care and education, health and nutrition, and parenting and family economic support. So I'm going to look at the examples here. So it's not a definitive a database of profiles, but so for example, in terms of access to early care and education, you'll know whether a state funds a pre-K program, as well as whether it supplements Head Start funding. So that's an example under that area. Another example in the health category is the early and periodic screening, diagnosis, and treatment program, which is the child component of Medicaid. And all the states are required to participate, but the question is, do they use the preferred screening? So those are examples. And then, and this one I'm sure you definitely can't see, but it's a policy tracker. And what we've tried to do is to be able to have information on all 50 states about safety net programs. So whether it's, and this one's for the state child and dependent care tax credit, but, and then it will tell you by, and this is just for the southern region, so Alabama, Delaware, Kentucky, et cetera. So the income eligibility criteria, as well as the cost per year. So the 50-state policy tracker is for not just the state child and development child care, but also income tax. At what annual income does the state begin to tax families? And some of them are taxed at or below poverty level. So to sort of look at what, and you can do it by region so that you can see where your state stands in the region. And then two documents that I would absolutely recommend to people, but I didn't have the opportunity in the time I have on my presentation to talk about them in any kind of detail, is Investing in Our Future, the Evidence Base on Preschool Education. It's a thin document, but a very powerful document in terms of what the research can tell us about the effectiveness of preschool education and what that means for our future. And another one is an early childhood program evaluation, a decision maker's guide that really describes if a policymaker is looking at early childhood programs and trying to make decisions about the kinds of programs that should be considered, then this is what the data tell us about their effectiveness. So both of those I would highly, highly recommend. And then as a close, in terms of talking about sort of what it is that would be important for us to do, I pulled this quote from a recent, this April 2014, that special issue of The Future of Children came out called Helping Parents, Helping Children, with the focus being that because major sources of stress in young children's lives arise from family experience, and because the quality of parental care is children's major resource for buffering stress, we must consider multi-generational interventions to address the multiple generational origins of children's stress. And so this entire special issue, Helping Parents, Helping Children, really promotes a two-generation approach to child development. And again, I keep saying, I know you can't see this, but the change model for two-generation programs is presented within this. And the focus is on the fact that you have your early childhood centers that help in terms of the development of children, their health, etc. But also, what is it that should be happening at the same time for parents? So the development of children is aligned with the development of their parents in ways that help increase the economic security of parents, their ability to nurture, care for, and educate their children, and what can we be doing at the same time that helps children in early childhood grow and develop as best they can. So I highly recommend this, this special issue. If you've heard about the two-generation approach, but you're thinking, I really don't know what it is or what is the research telling us about it, there are a range of articles within that special issue that talk about it, again, from a range of perspectives. So thank you.